Perhaps you see your loved one forgetting things, or they're getting confused at home, or maybe they're struggling to hold a conversation. Your immediate fear is Alzheimer's dementia, something permanent. But before you accept that diagnosis, I need you to check their medication list. I'm David, lead pharmacist at MyRxPro, and I've seen this too many times. A senior gets diagnosed with cognitive decline, everyone assumes it's dementia, but it's actually drug side effect. And in many cases, is completely reversible. I'm going to show you 5 prescription medications that can cause cognitive symptoms that look exactly like dementia. I'm going to explain why doctors miss the connection, and I'm going to give you the exact questions to ask your doctor to make sure they're considering this possibility. Here's what happens. When your parents get older, their liver and kidneys slow down. They don't clear medications as quickly as they used to, so drugs can accumulate in their system over weeks or months. On top of this, the blood-brain barrier, what separates and protects the brain from the outside world, gets leaky as we age. What's the result? A dose that's safe for a 45-year-old can build up to toxic levels in an 82-year-old. And that toxicity, it crosses into the brain and causes confusion, memory loss, disorientation, and it can look exactly like dementia. Now, why does the healthcare system miss this? Medical training teaches you what drugs to start. It does not always emphasize medication as the cause of cognitive symptoms. Instead, a senior gets labeled with dementia when they're actually experiencing toxic side effects. Fortunately, if it's caught early and the medication is addressed, these cognitive symptoms can improve. I want you to check their medication list for these 5 drugs. First are gabapentin and pregabalin. These are often used for nerve pain or neuropathy. High-dose gabapentin is especially common. Doctors prescribe these constantly for arthritis pain or neuropathy. In older adults, they frequently cause severe confusion, slurred speech, and an inability to focus. The drug accumulates in the system because aging kidneys don't clear it as efficiently. Second are prescription sleep aids, medication like Ambien or Lunesta. These metabolize so slowly in seniors that the drug stays in their system well into the next afternoon, causing daytime amnesia, disorientation, and they wake up groggy and confused. People assume it's dementia when it's actually the sleep medication lingering in their system. Third are bladder antispasmodics, medications like oxybutyn or tolterodine. These are used for overactive bladder or urinary incontinence. These work by blocking a neurotransmitter called acetylcholine, but acetylcholine is also required for short-term memory, attention, and complex thinking, so blocking it directly impairs cognitive function. This is the same mechanism I talked about in my Medications That Steal Your Memory video. Link is in the description, where Benadryl and Tylenol PM block acetylcholine and cause memory problems. Well, bladder medications do the same thing. Fourth are corticosteroids. Long-term or high-dose use of steroids like prednisone, these can cause acute confusion, memory loss, and severe mood changes. People assume it's dementia when it's actually the steroid. Fifth, certain beta blockers. Blood pressure medications like propranolol or metoprolol. Some beta blockers are designed to cross into the brain, which is helpful for treating anxiety or migraines. But in aging brains, they can cause lethargy and memory lapses that can look exactly like late-stage cognitive decline. Find any of these on your parents' medication list? That's critical information to bring to your doctor. And here's what makes this worse. Many seniors are on 2 or 3 of these medications at the same time. Bladder medication, plus a sleep aid, plus a nerve pain medication. Each one affecting the brain, each one slowing cognition. The effects stack. So you don't have one medication causing mild confusion. You have 3 medications combined to create severe cognitive impairment. This is the prescribing cascade I talked about in many other videos. One medication causes a side effect, the doctor adds another medication to treat that side effect, and that medication causes another side effect, and before you know it, your parent is on 8 medications. Some of them are causing the very symptoms you're trying to treat. If your parent is on multiple medications from the list I just showed you, that's a critical conversation to have with your doctor. If you find these medications on your parent's list, here's what you do. Do not stop any medications on your own. Stopping prescription medications abruptly can be dangerous. Instead, bring the medication list to your parent's doctor and ask these specific questions. Question 1, could any of these medications be contributing to the cognitive symptoms we're seeing? This opens the door. It gets the doctor to look at the medication list through the lens of cognitive side effects. Question 2, are there safer alternatives that don't cause cognitive side effects? Many medications come in different classes or formulations that work just as well, but don't cross into the brain or affect memory. The doctor might not have considered these alternatives because your parent wasn't having cognitive issues when the medication was first prescribed. Question 3, if we reduce or stop this medication under your supervision, how long would it take to see if the cognitive symptoms improve? This question frames the medication review as a diagnostic tool. If the doctor agrees to adjust the medication, they'll tell you what timeline to expect. Sometimes it's 2 weeks, sometimes it's 4 weeks. But if it is the medication causing the symptoms, you'll see improvement as the drug clears their system. Now here's an important point about timing. If your parent's cognitive decline started shortly after a new medication was added or after a dose was increased, that's a red flag. Dementia progresses gradually over months or years. Medication side effects can appear over days or weeks. Pay attention to that timeline. If the doctor does adjust the dose, watch for these signs of improvement. Less daytime grogginess, clearer speech, better balance, and more engagement in conversation. These are signs the medication was contributing to the problem. If cognition stays the same or continues to decline, it might mean there's another medication causing the issue or another issue that needs to be checked. Here's what I want you to do this weekend. Step 1, download the MyRxPro Caregivers Toolkit. In it is a list of medications that are known to affect memory and thinking. Print it out, check your parent's medication cabinet. Cross-reference their medications against this list. Step 2, if you find these medications, bring the checklist and the 3 questions I gave you to your parent's next doctor's appointment. Make sure the doctor knows you're concerned about these medication side effects. Step 3, if you want help preparing for that conversation, or if you need guidance on how to organize your parent's medication list so the doctor can quickly see what's going on, book a medication review call with me at MyRxPro.com. We'll review the medication list together. We'll identify which medications are the highest priority to discuss with the doctor, and we'll help you prepare the exact talking points to make the appointment productive. Cognitive decline isn't always dementia. Before you accept that permanent diagnosis, make sure your parent's doctor has ruled out medication side effects. Many causes of cognitive impairment are reversible if the underlying causes are identified and addressed. I hope this video was helpful, and if you know another caregiver dealing with this, share this video with them. Thanks for watching.